neurosurgery, mostly people don't have any exposure. If you go for MS general surgery, you will have some exposure regarding trauma, and you might attend this one month or 2 month course in the neurosurgery during your MS general surgery, but that is not enough to know more about neurosurgery. It requires a lot of mental strength to go through the PG period itself, because they might not see that much of mortality and morbidity in any other field. Maybe in oncology,
you may not have the proper setup in every hospitals. So how the scope in cities and town secondary cities like that?
Other than that, you require higher setup. Microscope and all becomes must. Microscope, C arms, O arm, and neuro navigation, neuro monitoring, everything becomes a must as you progress to the next level. So first thing which people must remember is that once they finish a 3 years course or even a 6-year course, they might not be able to do all the surgeries in neurosurgery at that time. You have to also remember that the neurosurgery seats are all on the increase. Last year, almost 30 people completed from Chennai itself, and within the next 2 or 3 years, it will become 50 people, because they have got neurosurgery in all the districts in Tamil Nadu.
As you said, mentioned fellowship. Like, what are the fellowships which will be helping practice? Where we can do it, like here in India and abroad? How the pay scale will be immediately after finishing? Like how the growth will be, sir?
Yeah.
And what about the abroad, sir? Like in Gulf or any other developed nations? Is there any demand for neurosurgeons from India or? Hello, sir. Thank you for joining us in this platform to share your knowledge regarding neurosurgery, the field, how the life will be after, during practice and all. To start with, can you share a brief about your career path till now?
Hi, Vinod. So, I did my M.B.B.S in Kilpauk Medical College in 2000 year. I joined in 2000, finished in 2005-06. And after that, I did MS General Surgery, Trichy Medical College, Government Medical College. And then I did M.ch Neurosurgery at Madras Medical College. Now I am Assistant Professor of Neurosurgery at Madras Medical College itself.
Okay, nice to hear, sir. Like during your career path, like from UG till now, like how you made decisions, the critical, there will be some points where you need to decide which way to go, like that. So did you have anything like that in your career path, and how did you manage that?
Firstly, I did, before I came to the M.B.B.S itself, in the school days itself, I wanted to be a neurosurgeon. So I took M.B.B.S itself to become a neurosurgeon. So after finishing M.B.B.S, during the entrance examination, I wanted to join the 6 years course. Neurosurgery, it's a major decision whether you want to go to the 6-year course or 3 years course. Nowadays, 6 years course has been completely removed from almost every place except CMC Vellore, and there is proposal to bring it back. Actually, 6 years is needed to learn basic neurosurgery. Neurosurgery is unlike other fields of surgery. Neurosurgery, you have to completely forget what you learned in general surgery and then begin as a neurosurgeon. So it needs 6 years. So I wanted to join as 6 years, but I couldn't get that 6 years course. So I joined MS General Surgery. During MS General Surgery itself, I concentrated mainly on neurosurgery. Even my dissertation thesis, which I did for MS General Surgery, is about head injury. So from the beginning itself, I was going mainly towards neurosurgery. So there is one decision for people. Second thing is neurosurgery, mostly people don't have any exposure. If you go for MS general surgery, you will have some exposure regarding trauma, and you might attend this one month or 2 month course in the neurosurgery during your MS general surgery, but that is not enough to know more about neurosurgery. So what I think people must know before taking a neurosurgery course is that it requires a lot of resolve. And main thing about neurosurgery is people have to remember that there will be a lot of mortality and morbidity. And people must have the mental strength to take that mortality and morbidity. Okay, a lot of people, almost 25% of neurosurgeons don't take risky cases. They do mainly practice neurosurgery as a medical practice, give them medicines, treat conservatively. That is mainly because they are unable to take the result of mortality and morbidity which is happening during the surgery. That is the main thing people must know before taking neurosurgery. And after doing MS also, I wrote neurosurgery only. I didn't even take the second option. There used to be 2 options which we can take during entrance exams. So I wrote only neurosurgery, and I landed up neurosurgery after 3 attempts.
Okay, sir. Since your aim was to become a neurosurgeon, I think you don't have any other dilemma during your career path. Okay, that's nice to hear. Regarding that, during post-graduation, during neurosurgery, like how the learning will be like compared to any other, for example, orthopedics or anesthesia or pediatrics or any other general surgery. So, in compared to that, like how the learning will be, the duty hours, how the postgraduate period will be there.
Postgraduate period mainly would depend on where you practice. So, if it's a very a high volume case center like Madras Medical College, where I did my post graduation, you will be on your toes, and there will be definitely night duties and all will be there. Emergencies, traumas will be coming in. Not only during the PG period, during the whole practice, you must be ready to get up from the sleep anytime case comes. Case can come at any time. Emergencies, they will become bad if you even delay for half an hour, 1 hour. The case will become bad. So you must be ready and to get out of bed at any time. And during the post graduation, main thing we have rotations and all will be there. So you will be doing night duties. Night duties in a center like us where there are a lot of PGs, you will get 2 duties per week. In other centers, you may get more than that. 3 or 4 duties also you can get per week itself. So during those duty days, whichever center you are, you will be busy. You will not be able to sleep at night and all. You will be busy, you will be operating, you will be seeing patients, morbid patients who you cannot delay. And other than that, the elective cases and all you can wait and do. So during the daytime regular work and all, you might have to just go with the, will be comparable to other fields, ortho or anesthesia, it will be comparable. You have to assess the patients, do workup and all that. And main thing in neurosurgery is that there is no fixed treatment protocol for most cases. The field is still evolving. So there will be a lot of discussions, and you have to learn a lot, and you can try a lot of new things in neurosurgery also during the post-graduation itself. So there is a lot more chance of putting new ideas and new papers and all during your PG period. Definitely, all the neurosurgeons would have put something extraordinary during the PG period itself. So that opportunity is there in neurosurgery. Doing new things, finding new things, and all that.
Okay. I think you spoke about the rate of mortality in the neurosurgery. So how could you manage during your post-graduation? Since the government hospital, I think there wouldn't have any much problem with that. But during your practice, how you are managing that? And how the life is now during practice?
Tell people something. It requires a lot of mental strength to go through the PG period itself, because they might not see that much of mortality and morbidity in any other field. Maybe in oncology. In oncology also, people will know that they are going to die. Some of my PGs, co-PGs and junior PGs, they were unable to cope up with that. One of my co-PGs started having nightmares, and he went through psychiatric treatment, and then came back and finished the course. Another one junior PG had a lot of trouble. He attempted suicide also, and he left the course. He didn't complete it. So people must remember that there is a person who will be sitting next to you, who will come to your clinic, sit and speak. He will be dead in 2 or 3 years. So that can happen. You will operate a person who is with GCS 15, moving all his limbs and all. After you operate, patient might not wake up from the anesthesia, or he might have paraplegia or hemiplegia for the rest of the limbs. So all of this is possible. Yeah. So you must have a lot of mental strength to go through that. To remember that you are trying to do good for the patient. Intention is good. Results are left to nature.
I think this information will be very vital take-home information regarding selective neurosurgery, I think. So do you think the dropout rate is a bit more than any other post-graduation in neurosurgery, sir?
What the dropout rate?
Dropout from like course, you said like they quit the course, some of your colleagues like that.
Yeah, one of my juniors quit the course.
Trend in
dropout rate is very little. Mostly they don't drop out. They cope through. But you have to be ready for that shock during the first year seeing patients dying before your eyes. Once you go through that, it should be okay. Yeah.
Okay, sir. Like during practice, how the life will be like in the regards to the thing which you said now, like because we have to manage the attenders, like how we are coping with that, sir, during practice. Because in hospital, in working conditions, it may not be much a problem, but during practice, I think you have to be like good communicative and you have to talk to them properly. And because in the recent days there is a increased violence on doctors is also there. So like how you are managing that, sir, now?
That's what you must counsel the patient. First thing is we must always counsel the patient about all the side effects, and they must be ready to accept the side effects, morbidity, mortality, everything. They must be able to accept. Only then you must operate on those cases. Now I'm consulting in almost 10 hospitals minimum in Chennai alone as freelancer. So whenever I see the patient in the OP itself, once we have decided on the course of treatment, whether it is surgical or medical, I make them sit and explain to them all the various options available and what all could happen to the patient if he is not treated, if he is treated medically, if he is treated surgically. Sometimes surgical patient may have a better output. Output implies patient can live 5 years maybe with the tumor, and patient may die if you operate. That thing is there. So that also patient must be able to take the decision. The quality of life may be okay till the patient dies, even if it's a 6 month. Patient can live with a better quality of life and die in 6 months. In glioblastoma multiforme and all, if the patient has, the life expectancy is only 6 months to 1.5 years. So some patients prefer the patient to have a good quality of life till he dies. So they might not go for the surgery. That options and all you must tell about the morbidity and all that can happen during surgery. But after surgery, the patient can live for many more years with a hemiplegia or a paraplegia. That option must be given to the patient. Patient must understand that and then come to the surgery. That's the main thing. If they do that, then mostly they won't have any problem with this.
Okay, sir. So then regarding the scope of after completing the post-graduation, so like immediately the freshers say what are the opportunities available? Because you may not have the proper setup in every hospitals. So how the scope in cities and town, secondary cities like that?
First off, in neurosurgery, there are a lot of things. You'll be very surprised about the amount of surgeries and the scope which is there in neurosurgery. That is, you can do a trauma, you can do neurovascular. Neurovascular nowadays we have endovascular also. Endovascular, that means like angiography. You do angiography, you do aneurysm coiling and all that in endovascular itself. Okay. Then you have aneurysm surgeries, skull-based surgeries, and you have trauma, tumor surgeries, and you have functional neurosurgery. So there is a lot of things in neurosurgery itself. For everything, you don't need a very big setup. For if you want to do trauma and basic tumors and all, you can do in any setup, any simple hospital with a proper ICU. You can do it. If there is a CT scan, which is good, because there are some cases in court and all where they penalize the surgeon for doing the surgery in a place before the CT scan. So CT scan, ICU, if it is there, you can do the neurosurgery, most of the neurosurgery cases in that setup, tumor and trauma. Other than that, you require higher setup. Microscope and all becomes must. Microscope, C-arms, O-arm, and neuro navigation, neuro monitoring, everything becomes a must as you progress to the next level. So first thing which people must remember is that once they finish a 3 years course or even a 6-year course, they might not be able to do all the surgeries in neurosurgery at that time. So as a fresher, it will be imperative to join somebody who is good. And in the field, if they want to pursue, that is, neurosurgery is not like a young field. Okay, you have to concentrate on something and go towards it, because everybody cannot learn all the surgeries which come under neurosurgery. Oncology, vascular, everything is totally different. Endovascular, if you want to go, you have to at least do a fellowship or train under somebody who is doing proper endovascular work for 1 or 2 years. Then only you will be able to start doing endovascular. It's completely like an interventional radiologist job. They are also doing endovascular work. So first thing is, after coming out, you have to select a place where you will be able to learn and do that. Or if you start practicing, you will be doing trauma cases, and you have to learn tumor cases on the go as you practice. Like me, if you are in a government setup and also freelancing, you can learn. Other than that, if you're a complete private candidate, it will be always better to work with somebody who is doing good work for at least 2 to 3 years. Then only launch your own setup or own independent practice. And next thing is, for now, there is a lot of vacancies in neurosurgery. For freshers itself, there are a lot of vacancies, and consultants also you can become. But you have to also remember that the neurosurgery seats are all on the increase. Last year, almost 30 people completed from Chennai itself, and within the next 2 or 3 years, it will become 50 people, because they have got neurosurgery in all the districts in Tamil Nadu. From Tamil Nadu itself, per year, 50 neurosurgeons, new neurosurgeons will be coming. That much case is not there in neurosurgery. So it is going to become very competitive in next 5 to 10 years. So if you join this year, by the time you finish, it would have become very competitive. Right now, there is a lot of opportunity, lot of vacancies, both in government setup, both in private setup, and for freelancing. Everything, there are a lot of vacancies right now.
Okay, that's very vital information, sir. Like regarding like fellowships, sir, like, as you said, mentioned fellowship. Like, what are the fellowships to which will be helping practice, where we can do it, like here in India and abroad?
Yeah, fellowships are available. That's the thing. Even during the last conference, there was one topic on this itself, whether fellowship is needed or not. Fellowships, most fellowships are 2 years fellowships. Both in India it is available, both in abroad it is available. you can do that. But most of the time, doing a fellowship without having a hands-on training and all is much less needed than working in some place with hands-on, where you can have high volume cases. So fellowship opportunity is definitely there. A lot of fellowship opportunities are there. If you're ready to spend and work for 1 or 2 years without much pay, you can definitely do a fellowship course. In India itself, a lot of fellowship courses are there. So once you finish this, that also is an option, doing a fellowship for at least 2 years. So for that, you must be exposed to all the fields in neurosurgery.
Okay. Is there anything like in-demand fellowship, anything like that? Is there? I'm just asking. I don't know exactly.
In-demand?
I mean, like this fellowship is like the corporates or hospital or they are asking for anything like that. Is that the particular fellowship?
No, that's like what I tell. If you do a fellowship, okay, your skill improves. But if you go to the field, there is no demand or anything for a particular fellowship. Okay, so everybody will be treated alike only. So you can tell if you something totally different like endovascular. Okay, so you can tell that you'll be doing endovascular cases. You'll be using the cath lab in the hospital if the hospital has cath lab. But problem is the endovascular is already populated by interventional radiologists also. So if you go that way, you will be competing with the interventional radiologists. The advantage of neurosurgery mainly is that most other fields will not come and touch any of your cases, unlike SG and nobody else will come and take your cases. Nowadays, ENT is coming and taking some of our cases like pituitary and CP angle, ENT people are doing. But interventional radiology has come in a big way and they are taking most of the neurovascular cases. So if you go the neurovascular way, which has some demand, that fellowship maybe must be needed. So if you go the neurovascular way, you will get advantage in a corporate hospital with a cath lab, but you will be competing with the interventional radiologist also.
Okay. And so next, regarding that pay scale, like how the pay scale will be immediately after finishing, like how the growth will be, sir?
Yeah, that
in different setup.
Yeah, there are different types of setups. First thing, one is a government setup. Second thing is a corporate setup. Third thing is a freelancing. All three is an option for you when you come out. Government setup, there will be fixed pay. If you go to an institute like AIMS and all and join central government courses, central government places, you will get good pay. And you might not need to do freelancing or something. You can settle in that thing. If you go for state government jobs like in Tamil Nadu, you will be able to get okay pay, but you will have scope for doing freelancing also. That is one. Second thing is corporate. Corporate right now the pay scale is around 1.75 to 2 lakhs once you get out. That is as a fresher. After that, there is scope for improvement based on how much cases you take and all. Then you can speak for cuts also and get it done. There is a scope now. But as the demand increases, it might also come down like plastic surgery and all, where they give the pay for freshers as only 1.2 lakhs. Like that, it may come down in 5 or 10 years. And even then, the cases increase, PGs increase, it might still come down. Right now, that is the state there. 2 lakhs fresher you can expect. And the next thing is freelancing. If you go for freelancing and if you are really have the tempo to go at any time and operate, and in that case you can earn a lot. That is mainly based on how you approach the patient, how you speak with the attenders, how you operate your skill. It may become a hit or a flop. Both can happen. If it becomes a hit, you can. There is no limit at all. As much cases as you operate, you can get as much pay as possible. That is a higher thing and a high risk thing also. There won't be any fixed pay. Some month you might not even get a single case. Only your OP charges should cover your expenses. Other month you might get even 10 cases 15 cases. That is another kind of practice. Everything is right now. Opportunity is there in neurosurgery in all the fields, and even in the corporate setup. If there is, if you go in the northeast or northern states and all, pay and all is very high. So you can demand that and get a pay. You can even as a fresher, you can get 3 to 5 lakhs per month in northeast and all.
Okay. And what about the abroad, sir, like in Gulf or any other developed nations? Is there any demand for neurosurgeons from India? Or
yeah, you can go to UAE. UAE is an option, but you have to go through the proper setup. There might not be any tests and all. You can directly go to UAE. But cases will be very, very less, and you will not be mostly operating because most people who can afford neurosurgery in UAE prefer to go to Europe or UK to get operated. So you will see that, and there might not be much scope for improvement for that. That is one thing. Next thing is if you want to go to UK or USA doesn't much recognize our course. So you might have to go again and do a residency there. It's just like starting from scratch. So if you want to do surgery in USA, which is very, very rare, very difficult to get, it's better to do after MBBS itself, not after finishing it. But it's almost very, very difficult to for a non-American to get into the neurosurgery. Getting into a surgery itself is difficult, but some people do that. Neurosurgery is very difficult. UK, you can go. You can write FRCS. It is available. Using that, you can register there, and then through contacts and all, you can go. It's a complicated process. You can do fellowships. Fellowships are available. Then Japan, Korea fellowships are available. You can go there, stay for 1 or 2 years, do fellowships, and come back. That will help your practice. But going there and settling is not much of an option. Australia neurosurgeons, again, they have to write exams. Go there, work in the private area, invest some 5 to 7 years, then only you can go and school there. So it's better to practice in India. Better.
Okay, that's a very good information, sir. Okay, like how you are managing your personal life in this neurosurgery? Like, is it compared to like any other surgery field, or can say like some percentage it is more than like we have to sacrifice our personal life in neurosurgery, anything like that?
Yeah, this mainly based on how you practice.
Yeah,
you can practice in a single hospital, go have a fixed time, have a duty during the duty time alone, go and operate in the night and come and sleep. That is a option. What I am doing is freelancing. Freelancing calls will come at any time of the night it will be available, and even during Sundays or holidays I might get cases. So personal life, you must have a understanding partner. That is what is very, very important. Then only you can pursue it. Otherwise, you can do mostly conservative neurosurgery only. If you want to actively practice neurosurgery, you definitely require
an Okay, sir. Okay. So, lastly, like, do you want to say any take-home message for the people who would like to pursue neurosurgery?
Yeah. What I want to tell is people must take neurosurgery not for money, not for the name and all. People must take neurosurgery only if they love doing neurosurgery. Love doing high-risk cases where you can make a patient who is unable to walk, unable to see, and also a slight movement of your hand kill them also. So that possibility, high-risk surgeries, that you must be able to tackle. Only if you love those kind of situations, life or death situations, then you must take neurosurgery. Second thing is, you must have a tempo for science, tempo for doing new things, tempo for thinking and innovating. because this is a very, very young field. This is not like general surgery or urology and all. In this field, everything is new. Anything can be done. Anything which you learn in general surgery, urology, most of the ideas in neurosurgery doesn't come from neurosurgery. It comes from other fields. And then they are taking over in the neurosurgery. Not only in other fields, very different kind of ideas can be practiced upon the patients. And those are becoming the next regimen. So you must have a tempo to do something new and innovative thinking, creative ability must be there. Similarly, in neurosurgery, most of the surgeries are not procedures like hernia. In hernia, I mean step 1, step 2, step 3 is there. No, like that, nothing is there. Once you go inside, everything you have to plan for each case. And you have to decide how the surgery is going to be. You must be that much creative to do the surgery. So creative mind is also needed. Only you have the aptitude for all these things, then you must take surgery.
Thank you, sir. Thank you so much for providing valuable detail about the field. I think it will be very useful for those who like to pursue a neurosurgery. Thank you so much, sir.
Thank you, Vinod, for the opportunity.